no secret as to how I got my name. I was born on Hari Raya. so the only thing that belongs to me is actually Su, because my name is Fitri Suraya. So yeah, anyhow, that's a bit about me. I'm a lecturer actually. I teach at University Malaysia Sarawak, and I'm part of SCAN. So I was told to introduce SCAN first. So let me talk a bit about what we do. So we're based in Kuching. Our membership recruitment is just people in Kuching, to be honest. But now we're getting traction. Even people who are in UK wants to be part of our group. So yeah, we probably need to rethink about our constitution, because our constitution sebenarnya when we established, we wanted to get together people who can be our voice for cancer patients. Jadi our membership is actually quite small. We only have about 80 plus people. Yang betul-betul active is about 20. And then, but I think all of us are very concerned about access to healthcare and support. Jadi, can you go to the next one? Yeah, so these are the three big pillars of what we do. Cancer advocacy, I think we're the only cancer NGO in Sarawak that actually looks at advocacy. Yang lain-lain tu banyak tengok benda lain lah, yeah. Cancer awareness and cancer support, patient support. So we talk to the doctors a lot. So I'm not a medical doctor, I tak pandai. I only did a PhD in education. So my strength is really in looking at how we can translate, the worries that people have, and then also the medical information to the layperson. So that's essentially how my role is in SCAN. Can we go to the next one? Yeah, so these are the issues that we look into. Can you click another time? Oh, sorry, go back. Oh, this is not coming out. So yeah, these are the things that I'm going to focus on for today's talk. The cancer awareness, the early screening issues, and also the access to treatment. Next. Yeah, my pictures are not coming out. We understand that we cannot do the advocacy if we don't have data. So that's why we are now very into research, and because we want to understand what really goes on when people try to understand what cancer is, how they actually go through the cancer and all that. Next. Okay. So we ran a survey back in 2018, and we got about 300 plus people answering. This was funded by Roche. That's why you see the logo there. But what we found at that time, we were established in 2017. So this was done in 2018. And we found that people sort of tahu but don't know, not sure what it is. Yeah, what can be done about cancer and all that, the cancer knowledge. So these are the constructs of the survey itself. The current level of knowledge, sources of information, interest, knowledge and myths, awareness about the risk factors, fears, attitudes, quality of the healthcare system that we have in Sarawak, and also the areas to improve. So based on this, move on, we found that kalau family tak support, it's terribly difficult. Yeah. Self-denial, oh my goodness, it's huge. Ramai yang masa 2020 tu, just before the pandemic, we interviewed the doctors who worked at our breast clinic dekat SGH, Sarawak General Hospital, and what they were telling us was ramai cancer patients yang datang for breast screening dah stage 4, stage 3, stage 4, and kita minta dia ambil gambar kan, and they showed to us, and we're like, oh my god, it's so horrific. So we spent time to talk to them, and then memang jenis yang kan, kalau the tumor tu dah besar, you can't avoid it. It's so huge and it's on your breast, because it's on your breast, they don't want to talk about it. So dia tunggulah sampai tak larat lagi dah, so that's why it's selalunya fatal lah, yeah. Self-pride, do not bother, stuff like that is very common. And ada yang takut doctors bagi unnecessary treatments. Itu pun ada. And then dia rasa macam tak payahlah, you know. But because they don't know how to talk to doctors. That was one thing. And then the issues that we tried to advocate at that time was about early screening, cancer awareness education, all this lah. Move on. So because of what we saw early on, so a few of us got together. We wrote a book for patients to guide them when they first get the diagnosis, right up to writing your will, right up to what your your families can do after your death and all that. Getting together the survivors to put together this book was actually quite difficult. I didn't think it was that. We read a lot of books together before we wrote that book, because we wanted to make sure that people understood in a sort of layman way. Jadi we listed out all the questions. Jadi kalau dia tak sure, they can refer. And then what I noticed when we were disseminating the book as well was that we needed to talk to the doctors as well. Sebab ada some doctors, dia terus pergi pada case, which I think is common lah kan, sebab kan doctors ramai patients nak kena jumpa, dia faham lah. Tapi that also leaves the patients like unsettled, because they're not really sure what exactly is going on in their body. So last year we did something quite ambitious. So we got money from UICC, quite a bit of money actually from UICC, and we got a small grant from Unimas. We went to an area yang memang banyak urban poor. Jadi just outside of dalam Kuching lah, but just a little bit outside. And we started there to do our pilot. Lepas tu we went to Sarawak ni interesting. Dia ada 3 sort of types of communities that you'll see. Yang dekat sini is all the mountain people. They know mountain people. So this is the Crocker Range. So we went to Bakalalan. Paling jauh kot 5 jam dalam 4-wheel drive. It was so interesting. And by the time you get there, it's just purely fresh air. No aircon, no nothing. Oh my goodness, it's like the best. Makan semua organic. And we had a hard time looking for cancer patients in that area, because we wanted to interview cancer patients. Susahnya, I tell you. Mulanya I thought it's diorang tak nak cakap. Tapi sebenarnya memang because everything's organic. They're eating really good food. They're sowing basically their own seeds and they're eating them. And then tapi ada juga jumpa, we interviewed them. All the interviews that we've done, we actually have produced a video based on UICC punya requirements. It's actually online. So we went to Bakalalan. After that, we went to Kapit. Kapit is here. Ini pun mountain. Kapit is a hotbed for malaria. If you don't know, this is like malaria central for Malaysia. So went there. This was interesting. Kapit was where we found women yang literally was left because right after diagnosis, their spouses do not want to be with them anymore. The spouses just leave. They pack their bags and just leave. So the women had to fend for themselves. So kalau tak ada family support, memang teruk lah. We found this lady yang masa dia kena breast cancer, the husband also got stroke. Ya Allah, we were like nak menangis kot masa dia bercakap dengan dia. But she was very strong. It's amazing to see how people actually, how resilient people are when they go through challenge. So ada juga yang masa kami buat interview, sebab dia, the cancer journey was terlalu painful. When we took photos, she doesn't even want to look at the camera. Dia memang tak nak langsung dikenali, sebab dia punya proses masa go through that cancer was really actually quite painful. After that, we went to Mukah. And Mukah this is coastal. Tadi saya cakap mountain kan. So we went to the coastal, Mukah. Mukah was interesting. Also macam dekat Kapit. Kapit is predominantly Iban. Mukah predominantly Melanau. And apa nama? The understanding about things are different. Jadi dia banyak macam buat sembah things from the laut, you know, those kind of things. Jadi we have to hormat lah. Jadi ada benda yang you tak boleh buat, you tak boleh cakap, you know, all those things. Jadi those are the things that we captured in our research. It's very different from Kapit. And then after that we went to Serian. Serian was quite close to Kuching. But Serian was quite interesting because it's just outside of Kuching, but the lifestyle is completely different. It's like they want to be orang bandar, but they want to be in a kampung. And they do not really like to go seek for advice because there's always like ada bomoh kampung lah that would tell them, you know, what is going on and all those things. Jadi dia lebih percaya kepada things which is close to them. Yeah, walaupun they literally just 1 hour from Kuching. So these are some things that puzzle us lah. We tried to understand. I'm still analysing the data, to be honest. Go ahead. Yeah. So what we found, this is my plane view nak turun ke Bakallalan. It's amazing. It's a small plane. Cuma 12 orang je boleh masuk. Kalau ada ayam, ada livestock on the plane, the human will have to go. Yeah. So every time masuk plane, you have to weigh yourself. It's quite interesting. So yeah. So the myths are still very strong. Macam dekat Kapit, there was one lady, when she was diagnosed, she literally did not want to tell anyone outside of her family. Because she said, if I was to open my mouth, everybody's going to tell me that I was going to die. You know, so, and it was just like stage 2. You know, and she knew it was coming because her mom got it, her mom's sisters all died because of it, you know, because it's in the genes. So when she found her lump, and then dia dah tahu dah kata this is definitely going to be cancer. She went for the diagnosis sendiri, dia tak cakap dengan orang. When she confirmed it, she did not want to tell anyone. And then and bila people find out, dia orang kata macam, you dah ada racun in your badan. Why you want to seek for some more racun put inside? Dia kata, you know, it's because chemo kan, nak go through chemo apa semua tu, it's all racun to them lah. That's how they call it. So the word in Iban also that was used is also signifying that it's a fatal racun. You know, it's a fatal poison. That's how cancer is perceived there. Support from family and the carers are so important because the travelling, the time to get to the hospitals actually take up a lot of their finance. Ada this lady yang kami jumpa masa di Mukah, dia kena cancer masa COVID. So what happened was because of the COVID restrictions that you can't travel, you know, unless you get swabbed and all that. Because she was tested positive like a couple times on COVID, she could not go and get her treatment, you know. Tapi masa tu actually she was already due for treatment and all that. This is what I said tadi. Men are more likely to leave their spouses. Men are more inclined. This is the one that I just found out. Men are more inclined to have their wives stay with them if they are the ones who are diagnosed. And this I learned from 22 days taking care of my dad. My dad just passed away about 50 days ago on the 3rd of January. So in December, you know, we were taking care of him, didn't know he had cancer. That's why saya tanya soalan tadi pasal apa yang bakar dekat rumah tu. Because my father loves doing that. And we don't understand why. And then he doesn't smoke, he doesn't drink. My dad is like so straightforward punya person, but don't know where the cancer came from. So we brought him to the hospital. Immediately it was already stage 4 and we couldn't do anything. So it progressed quite rapidly. So anyhow, blessing to all that was I was able to spend a lot of time in the hospital, and I talked to the carers in the male RTU. And most of them are like 90% are women and wives. And this is in a male ward. And the facilities are all for male. And can you imagine if you're in the ward and you can't even take a proper shower because it's not actually covered for you, you know, it's so inconvenient. So bila saya tanya, saya nak faham better kan, semua macam the pesakit tu memang dia tak nak anak dia jaga. To them it's like dia tak nak lah the children to see them sick, the children to clean them, you know, all those things are very, I think, sensitive lah. So faham lah, kita understand, tapi mungkin a policy that we will advocate after this is really to make sure that, you know, the facilities for the carers actually is quite important, to make sure that their lives are not affected. There was one lady who was right next to my dad's bed. Her kaki was actually swollen because she was standing quite a bit. The husband is quite heavy, so she had to carry him. So whenever, you know, he needs movement, she's the one who's the crutch. Eventually dia yang sakit. Ya, kesiannya. You know, so all these things are things that actually happen. Yeah, go ahead. Yeah, so impact of our work. We talk a lot, like what I said, with the medical specialist in SGH. Dr. Voon, our oncologist, our head oncologist, is like a dynamo. He has so many ideas about research and all that. So we do what we can to collaborate with him. But we also talk to our deputy premier. This is Dr. Sim. And he's pushing for a cancer hospital. We don't have a cancer hospital yet in Sarawak. And evidences from things that we are finding out on the ground is all directly sent to him. Yeah. So this was what we did a couple months ago when we launched our video for UICC. So yeah. Yeah, so yeah, thank you. And I want to leave you with this, because this was what we all agreed to be like the tagline for our video, which is where you live should not determine if you live. So yeah, sebab everybody has their own sort of geographical things, and yeah, memang susah, memang susah. So we hope that the bits that we can do in our little NGO will make some kind of a change lah dekat Sarawak, hopefully, and perhaps we can share that with you as well here in Semenanjung. Yeah, so with that, I thank you.